Hi, everyone. Welcome to FAIR's free webinar. My name is Carrie Mokowski. I'm a National Programs Manager here at FAIR, and I will be your moderator for today's presentation on how food allergy families can really become better aware of all the many people in their child's network. Just a little bit of housekeeping before we get started. This presentation is going to be recorded and posted on the FAIR website in about 7 to 10 days. We'll also be following up with all of you in about that time and email you a link to the recorded presentation, so you can be on the lookout for that. Please note that for maintaining a quality recording, all attendees are going to be muted throughout the webinar. However, if you're having any technical difficulties, you can always use the questions and chat feature that you see on the GoToWebinar toolbar on the right-hand side of your screen. If you're on Twitter, we encourage you to join us in conversation during this broadcast. You can follow along with our webinar live tweets at our handle @foodallergy or #FairWebinar. I also want to just give a quick special thanks to Free2Be Foods for their support of this webinar. And now I'd love to introduce today's webinar presenter. Today's presenter is Dr. Glenna Crooks. Glenna is a strategist, innovator, and trusted counsel to leaders. A former school psychologist who pioneered the earliest IEP approaches, she was a Ronald Reagan appointee, global vice president of Merck's vaccine business, and founder of a global health strategy firm. Known as a one-woman think tank, she has a talent for organizing chaos and solving complex problems. In her latest venture, The Network Stage, she describes a new way to lessen the overwhelm of modern life. Her approach has won her recognition, such as the Samuel G. Society Award for Celiac Disease Management and Disruptive Woman to Watch for Alzheimer's Caregiving. Glenna is a fellow of the University of Pennsylvania Center for Neuroscience and Society and a fellow of the Drexel University Center for Population Health and Community Involvement. She's a member of boards focusing on rare diseases, orphan drugs, children's health prevention, and biowarfare countermeasures. She received the Congressional Exemplary Service Award for Orphan Products Development and is the first civilian to receive the highest award in public health, the Surgeon General's Medallion from C. Everett Koop. She is a Mushin Zen artist, donating her paintings to fundraisers for children with special needs. At this time, it is my pleasure, and I am very delighted to turn it over to Glenna.
Okay, Carrie, do I have the control of the slides?
You should.
Oh, there we go. Well, hello, everyone. It is really nice to join you today. I'm looking forward to presenting this information and to hearing your own responses, either after this presentation or later as you think about the materials. Well, how many times have you heard it? It takes a village to raise a child. Well, in fact, it takes a village for all of us to live healthy, happy, successful, and satisfying lives. I've been studying these villages now for more than a decade. If you're familiar with the work of Brené Brown, my research methods are similar to hers. We don't have hypotheses to test or preconceived notions to prove. What we do is we talk with people and we allow what they tell us to inform what we write about. My results are published in a just released book called The Network Stage: Realize Your Network's Superpower. In doing the work, what happened is that I identified 7,000 different types of people who support working adults and 4,500 who support parents in raising their children. Now, long lists are not good organizing tools, and so what I've done is group those people into 8 different networks based on the role that they play in our lives. I'm going to describe them very briefly here and then go into much more detail later. The 5 that you see on the right-hand side of the screen are networks that I call birthright networks. That's because you were born into them. And if you have children, these are the networks you're creating for your children. A family network, a health and vitality network, an education and enrichment network, a spiritual network, and a social and community network. On the left side of the page, what you see are three networks that I call coming of age networks. A career network, which is where we usually think about networking, a home and personal affairs network. Personal affairs being things like your banker, your car dealer, your lawyer, or your accountant. And then finally, a network that I call ghosts. Ghosts are people who used to be in your life who are no longer. But what we know is that everybody who does come into our life, even for a brief moment, can make a real impact on us. Now, my first opportunity to apply this idea of networks and these villages was to celiac disease. This is a prototype based on a 5-year-old boy who's just been diagnosed with celiac. Later, you're going to see how we've applied this to food allergies. In this slide, you'll see the number of people in his 5 networks that his parents decide they need to inform. In all, there's 146. 19 of whom they consider to be high touch, meaning that they caused a problem, like they gave Adam a gluten-containing cookie or somebody was bullying him. Now, this doesn't nearly show the complexity as well as this mind map does. In this mind map, we've outlined everybody in his networks, and we have color-coded red every place where the connection needs to be managed because food is involved. Now, here's my last slide about celiac, and it's also the place where I'm going to include a commercial about public policy. I know from my own experience as a policymaker that the burden of any illness is not well appreciated by those people who are making policy decisions, whether it's about what drugs might be included in a formulary or how they might be reimbursed or what supportive services might be covered and how families might be supported in the caregiving. I was shocked myself to contemplate just what the diagnosis of celiac would do to this particular family. I did some back of the envelope calculations, and here were my assumptions. Let's assume that Adam's parents know all of the people that Adam is connected to, as I showed you on that last mind map, all those people who were in red. Well, what I can tell you is that no parent does. And by the way, I didn't either about my own life when I started to work on this project. But then let's assume that they not only know them, but they have all of their contact information. And then it takes 30 minutes to tell them about the celiac in an email that I will show you later, hold a discussion with them and make sure that they're getting support. In all, that's going to take his parents 73 hours or just about 9 working days. Who has 9 discretionary working days to do something like that, just to do this at the point of diagnosis? And that doesn't include all of the other things that you see on the other side of the page and that you would know well as a food allergy family. Later in this webinar, you're going to see a web link where not only are the handouts, which are included in your webinar invitation, will be, but also I'm going to post the case study of Adam in case it's of any value to you in any communications you might be doing with community leaders or with policymakers at the local, the state, or the federal level. And then also I've made a commitment to FAIR that we will replicate the Adam study, but this time it will be a child who's got a food allergy so that it's more meaningful to your own work. Well, based on what we've seen with Adam and the work we've done with other families, there are 5 steps to comprehensively then building a management plan for the village that supports your family and your child. Step 1 is to become aware of everybody in your child's networks. I'll show you what is going to be an easier way to do that. Step 2 is to determine where your child's health may be at risk because food is involved. Step 3 is informing those who need to know, especially those who are going to be with your child when you are not there to supervise. Step 4 then is to monitor and manage any problems. And then step 5 is to inform of important risks and later changes in any diagnoses. Now, one of the handouts and also on the website is a form that looks like this. It is a Word document. Some parents use it electronically and just keep it on a laptop or on a desktop. But you can also print this out. It's formatted for legal size paper and put it on the kitchen counter so that as you're getting started, this will prompt you to think about the people in these various networks. As you'll see, each of the networks has certain subgroups. And I want to talk about a couple of these that are important. In the family, I mentioned 4 different subgroups. The family of origin, that's the one that you were born into. So this would be your child's grandparents and aunts and uncles and cousins. Your family today, meaning you and your spouse or life partner, those who are, think of the people living in your household. Former family, these would be people if you or your current spouse or life partner were ever partnered before, and your child, and you might have some sort of shared custody arrangement. Former family are important as well, and a child would need a plan for each of the households where they live. This would also be key for foster children. If you are a professional working with foster children or foster families, every time a child is put in a new placement, a new outline or plan like this would need to be developed in order to be sure that the child was healthy and safe. And then finally, just like family, these are people that you're not related to by blood or by marriage, but you think of them as family. And these people today are very important in our lives. And here's why. 40% of Americans live on average 700 miles away from where they were born and raised. What that means is chances are you may not have close by family who can support you and help out when you need it. And by the way, even if you do, it's the women in the family who are the traditional caregivers, typically, and they're very often in the workforce and not available to help you out. I'd like to point out just a couple of other things about these networks. In the Health and Vitality Network is where I place appearance. What we know is that people who are good looking on average make $250,000 more over the course of their lifetime. But when they are children, they get breaks. And kids with food allergies who may be subject to bullying or may have other special needs, they could benefit from those breaks. And so teachers tend to treat them better. Teachers tend to give them more leeway. And so if that's an important consideration in your own family situation, appearance is not to be missed. In addition to that, your child's friends are very important. The research says that if a child has a special need of any sort, whether it's a healthcare need or an education need, if they have at least one best friend, they are much less likely to be bullied than those who do not. So shoring up the friend network, as challenging as that might be in the context of a food allergy, is an important thing to consider. Now, pets have networks too. And if you've got a family pet, chances are you have already checked to be sure that the pet food does not contain an allergen that is dangerous for your child. But the other thing to realize is that pets go other places and other people give them treats. So trainers and walkers and groomers and doggy daycare owners may need to know that there are certain treats your pet can't eat because it could place your child at risk. And then finally, the set of coming of age networks. As I said, we mature into these, and this coming of age process is a process. It's not an event. It can start a lot earlier than you might think, even in high school. If your high schooler has a job, they're starting to form this network that clearly are happening by the time your child gets to college. So it's important to be aware of all of these networks they're building and to take these into account. That's the first reason why I'm including it here. The second reason I include this is that as a parent, these are your coming of age networks. And so there may be certain situations in which you need to manage the food allergy. In one gluten situation, for example, the family had a vacation home which they rented out to others during the season. They made it a requirement that none of the renters could bring any gluten-containing items into the vacation home. They lost some regular renters as a result of that. But that was more important to them than the challenges of always cleaning the house as then they would go to enjoy the place. Likewise, in your career, you may have colleagues or others who visit you at your home, and they need to know that bringing a hostess item for you, which has an allergen in it, is something that they just can't do. And then you may also need to agree with those in your career network that from time to time you're going to need the flexibility in order to manage the child's allergies. And then finally, I talk about ghosts, even though we start having ghosts in our life, that is people who were in our life and that are no longer from the time we're kids. It's generally not until we're adults that we really think about them. And for your allergy child, this I think can actually be a very helpful exercise. Reminding them of the people who love them who are no longer there can go a long way on a bad day. And reminding them that hungry ghosts, the ones who were bullies and left them with a bruise or a hole in their heart, are gone and can no longer harm them, can also go a long way on a bad day. Third, this is I never looked for these ghosts, by the way. They started showing up when I talked with people. And another type that showed up was role models. Now, these are people that maybe you've never met, or maybe you've met only briefly and you may not see again. I tell you, I saw plenty of them at FairCon. Those middle school and high school kids and the energy they had and the caring and affection that they showed for one another was absolutely awe-inspiring for me. And I would only imagine that over time, especially as your children grow up, they'll have an opportunity to meet others who are managing food allergies well. Now, these sheets can get you started, but there's more that you can do. This is an example of other material, which is a downloadable handout from this webinar and then also on the web link you'll receive. And what we've done is we have taken the Adam case study. In the first column, we have listed all of the types of people, in this case, just that's a part of his family network. In the handout, in this Excel spreadsheet, you will see 5 different sheets, one for each of a child's 5 networks. Then what we've done is added the name in the first column, and we've got space in the second and the third column to add in the contact information. Now, I lost. Okay, I'm back. Okay, now at some point in time, you're going to want to get that contact information, but even without it, you can start using the Excel spreadsheet to do some planning. So for example, in the next column, you'll see an asterisk for every place where there's a food risk and therefore needs to be managed. The next 2 columns then say, okay, these people need to be informed. So for example, Gordy's the dog, we're not going to inform the dog. So people have to be told, and then who's going to tell them? Is it going to be mom or is it going to be dad? Now, in this case, what Adam's parents decided to do was send an email to everyone once they had their information. Dear first name, Our son Adam was recently diagnosed with celiac disease, a serious autoimmune condition. That means he cannot eat foods containing gluten, which is found in wheat, barley, and rye, and some foods processed in the same facilities as those three grains. As much as we would like to be present everywhere Adam goes to assure his health is protected, that won't be the case. There are times he will be under your supervision at school, church, playdates, sports, or family events, and we'll need to rely on you to help us protect him from the short and long-term consequences of eating gluten. We're still adjusting to this new diet at home, and we know what we are asking is no small task. That makes us immensely grateful for any assistance you can provide. We'll always be available to address questions you have, and we'll return the favor if you learn your children have special needs in the future. To make life easier, when we join you as a family for an event, we'll bring food Adam can eat. When we're not, we'll be sure his backpack is stocked with gluten-free drinks, snacks, and treats. We'll do the cooking and the reading of the labels. You don't need to do that. We'll follow up with a phone call in a week to address any questions or concerns you have. But in the meantime, would you let us know you got this email? Thanks in advance. We appreciate it. As a food allergy family, you can only imagine what else you could put in here about whether he's using an auto-injector, what special care plans would be needed in the event that he had an exposure. Now, the column in green, red, and yellow here that you see is the result of the phone call. There's nothing like the tone of somebody's voice at the other end of the phone to let people know whether you're really going to get support or not. And so this is one color coding scheme. You can develop your own. So green is good to go. We can trust them. Red is no, we can never let our guard down. And yellow is, well, maybe sometimes yes and sometimes no. Another thing that families can do is then look at other ways in which you want to collect information in order to assure that your child is healthy and safe. So if you have the NEMA device for detecting food allergens, you need to know, are people who might be caring for your child when you're not there, do they know how to use it? And do they have one? So maybe there's one at your house and one at grandma's house and one at the babysitter's house, but at least you know that. If they need an EpiPen or another auto injector, you can then look at, are they trained and able to use it and willing to use it, and do they have one? So in addition to his backpack and mom's purse, is it also at grandma's house and the babysitter's? And then as other conditions are diagnosed, and so many children with food allergies also have asthma, does the person know about the asthma, and do they understand how to use an inhaler, and is one available? The upshot of that then is the next column, which is all of the places where, based on this information, parents decide they need to be the most vigilant. And they're here noted in yellow. And then finally, another way to keep track and make notes for yourself. Some of the connections that Adam has just might be too young to understand. Grandpa may have early dementia, and so maybe he can be supportive sometimes, but not always. Some cousins are bullies, and sometimes that results in a bad event. Or maybe some relatives live far away, and so they're about to come for a visit, or you're about to go for a visit, and so it's an important thing to do to remind yourself that you need to remind them. Now, here's another reason why you'd want to have the contact information. Those of you who are connected with FARE probably saw recently this FARE alert. So now you know about this product and the milk allergy alert, but how do you inform everybody in your child's networks if your child has a milk allergy? Well, if you've already collected that information, you can batch emails and texts and send out notices to everyone as a group so that they don't have to be informed individually. So this network-based way of understanding your child's village and managing the food allergy, I believe has several benefits. First of all, it more easily and completely identifies every place where your child could be placed at risk. The next thing then is it becomes a more orderly way to engage and monitor and inform those people who need to know. I've tried to put myself in the shoes of a parent with a food allergy, wondering every morning what it's like to think he's going out the door, where is he going, who's he going to be with, do they know, should I tell them? If I do, he'll be standing out and then they'll, and he doesn't want to do that. But on the other hand, if I don't, I may get a call at the office at 10 o'clock. Then I need to get to the emergency room. So what the attempt is here to do is to make this much more orderly and efficient. The other thing it does is it allows some tailored problem solving within networks. A problem at school can be managed in a different way than a problem in a family or with in-laws, or a problem at sports, or a problem when there's travel. So it allows you to use the tools you have. In some cases, the regulatory requirements within school systems for assistance that you can have to make life easier, or allows you to tailor. So for example, if you've got a problem in the family and you need to seek help from a family counselor, you can be much more granular and I think better describe what's going on and work towards a solution. The other thing it does is it adds a focus on people to enhance the current focus on place. And let me tell you what I mean by that. As I read the food allergy literature, I see lots of advice about what to do at school or in a restaurant or in a hospital or on an airplane. The reality is it's not the bricks and mortar of a restaurant that create the risk. It's the people in that restaurant. And so to think some about the people, I think, adds to the focus of also thinking about the place. And then, as you've seen, it's more efficient when you're sending messages, especially if there's an urgent message that needs to go out, like the food alert, or if there's a change in your child's diagnosis. So I'm welcoming all of your questions and comments and aha moments, and if you choose to use this, your experiences. This is the web link for getting the handouts and the ADAM case study that I've described on my website, and the password. And here is my email address as well. You are welcome to be in direct touch with me. I am building a digital product to make this easier. And so any insights you get on this that will help us to make that better is what I'm hoping for, so that I can make your life easier and help you keep your child safer. And
Wonderful.
Carrie,
Yeah,
I'll take any questions.
yeah, thank you so much. We did have one question. I could have chimed in earlier, but someone was asking what the difference between family of origin and former family was.
Okay, well, your family of origin is the one you, as an adult, were born into. So your mother or father or stepmother, stepfather, or, the people you grew up with. So you may have had a mother and a father, and then they may have divorced, and you also have a stepmother and a stepfather. And then you have siblings, and you had aunts and uncles too. That family of origin is now your child's extended family. So that's your child's grandparents and aunts and uncles and cousins. And what was that, family of origin, and which other family?
I just deleted the question. Family of origin and former family.
Oh, okay. So former family is if you or your spouse or life partner today were ever partnered before. So if you have been married and divorced, then your former spouse is former family. And this is important right now in this country as well. Only 20% of families today are once married couples with children. 80% of families are single parent or divorced, blended, remarried families, or increasingly grandparents raising grandchildren because of opioids. So in one situation I know, a woman said, my husband from my first marriage is coming to my home with my second husband to care for our two children from our marriage, his two children from his first marriage, and our baby from this second marriage, so that my second husband and I can take his mother out for brunch on Mother's Day. So there's a family that has 5 children. 3 of them have the same father, and 3 of them have the same mother. And you can only imagine if one or more of those children have a food allergy, they're traveling back and forth between mom's house and dad's house. Dad may have a new wife who also has children, and then has, and his new wife has family. So there's another family configuration there. So it can be pretty complicated for
Mm,
kids today, far more than when, say, I was growing up, and divorce was quite unusual.
right. Thank you. Thank you for that clarification. That definitely makes sense. So this is a good question. I don't know if you'll have an answer, but maybe in all your work you've come across some advice you could give. But one of our attendees asked, how would you suggest that we influence those individuals who do not want to support us or our children with allergies? Should we avoid contact with them? Do you have any suggestions or advice to help influence others?
Yes, I do. In this methodology, I describe 3 types of people who will be in your networks or your child's networks. Now, the first type are primary. These are the people who are like closest into your heart, and dearest to you in any way. So think about yourself first. This is your spouse, your parents, your best friends, maybe your boss, your biggest clients, if you're in the workforce. Okay. Now, um, I call them primary because if they passed away or they cut off a connection with you, you would be devastated. Okay. And by the way, you had better put yourself on that list. And I see lots of food allergy moms, especially, having a difficult time with that because of the challenges of the food allergy. Now, for everybody who is primary on your list, you have certain intentions, like you want your child to grow up to be healthy and well educated and enculturated in your traditions. You hire people to help you do that. I call them support. So these are teachers and coaches and orthodontist and your child's pediatrician and so on. And then everybody else is transactional. So that's the wait staff in restaurants. It's an important transaction, but it's still transactional. If they get sick, you're not taking them soup. You're paying for a service, just as you are for someone who is support. So one of the first things that I would suggest you do, along with sorting out where your children may be at risk, is then determining among those people, primary support and transactional, where are you getting support and where are you not? And what can you change? Now, the next thing I'm going to say is going to sound counterintuitive, but there's a reason for it. The easiest changes to make are on the transactional side. So if you go to a restaurant and you find a great wait staff, then you might want to know what their shift is and only go to that restaurant when they're on shift. On the other hand, if you've gone to a restaurant and they don't have great wait staff, that's a transaction. You can stop it instantly. You don't have to put up with it, because chances are you have other alternatives. Now, the support group that I've mentioned is a little harder to change, but it will be worth changing if it makes your life easier. So I have worked with families where the pediatrician providing primary care does not necessarily agree with the allergist, or the gastroenterologist who diagnosed the celiac. And so that left parents very confused. You've got a choice in that matter. If you can't resolve it with the pediatrician is working for you. They're expendable. You can find another pediatrician. Um, with regard to the people who are primary, these are the most difficult. And this is a case where I always suggest if you've got some sort of a conflict with somebody who's primary in your life or your child's life, you need to seek professional help, whether that's clergy or a counselor, or maybe there's an expert in your support group who can help you out as well. But what I will promise you is if you've cleaned the clutter, if you've got the people who are not supportive out of your life, who are transactional and who are support people, sometimes the energy opens up to deal with the people who are primary. And I guess my story here would be a little bit like the sort of the relief you get when you clean your closet or your refrigerator or your junk drawer or the top of your desk. When you've done that, it frees up other energy to deal with something that's more challenging in your life. So the advice in my book is to start with the easiest targets of opportunity first. If what you need is a lot of patience with your mother-in-law, it's going to be easier for you to find that patience if you're not also struggling with people who are less important and who are more peripheral in your life or your child's life.
Great, thank you so much. Okay, one more for you. I have an attendee that says, or is asking if you know of any other tools that can help keep up awareness as kids age into teenhood. She mentions that when her son was diagnosed, she had, a bunch of cute labels while at school, and I guess a "Say No to Peanuts" T-shirt. But now that he's a teen, it's much less visible to others that he has an allergy, and she still wants him to, keep up and have that village and that support. And I know we saw so many teens a couple weeks ago, Glenna, at FairCon. And is there any tools or any kind of suggestions for, the older children as their allergy, becomes more and more invisible to others, and wanting to keep them in a network and have support of a village as well?
I don't know of any tools.
Okay.
The tricks that I've heard about from food allergy moms is to get their friends over to their house and engage them in the discussion and educate them and even practice with expired EpiPens, so that the at least the social network that the kids have as teens is informed and supportive.
I agree with that. And I know we hear from teens all the time, and really that self-advocacy goes a long way as far as awareness, especially amongst their peer group, and I know, like we were talking before, your village does change and evolve the older you get and the different life situations you find yourself in. So I agree. I'd echo that as far as, educating your social group and then being definitely your own self-advocate.
Well, and
So thank you. Yeah.
your village has changed. I mean, even a child's village changes often. I mean, every school year, every new sports season, if they try out for the school play, if you join a new church, you change neighborhoods, they join scouts. It's
Right.
it's a moving target, but what I have seen, I've worked with literally hundreds of people from age 7 to 87 over this last decade. And when people see their life through this lens, it makes it a lot better. And I would also say to parents, sitting down and doing this with your child um, has been really effective. I've even had grandparents do this with grandchildren, and the grandkids really enjoy showing off about all of their friends and the things that they do. And especially the older children get, the more that they are with people that the parent does not know. So it's important to get into the habit of collecting this information and realizing at milestone times it's important to get the information together.
Okay, great. I love the idea of sitting down with your child and doing it with them or other family members. I think that's so empowering. Okay, well, thank you for everyone attending. If you do think of any additional questions after this webinar in the next couple days, you see up here Glenna's email address, and she's happy to take emails from you. You can also email them to us at FAIR, and we can pass them on to Glenna at education@foodallergy.org. So with that, I would like to just once again give a thanks to Free to Be Foods for supporting this webinar, and then an additional huge thanks to Glenna for sharing such important and innovative information right before a big holiday. So thank you for your time, Glenna. We really appreciate it, and I wish everybody out there a safe and fun and healthy Thanksgiving holiday tomorrow. Thanks for joining us. Goodbye.
Bye.